All surgeries have potential risks and complications. Specifically regarding low back surgery for a disc herniation or a bone spur, they're fairly straightforward and very well known. There are others that I'm not going to include. However, these are the major ones. There's a risk of bleeding. Now, my average blood loss is less than 1 ounce. However, we're around some pretty large veins and you can bleed quite a bit. There's a risk of infection. The infection rate globally and nationally is probably around 3%. I've been very blessed in that my infection rate's very low. If you get an infection, you'll know in about 8 or 10 days, with fever, chills, redness, for example. But again, the risk of that is extremely small, certainly less than 1% in my practice. There's a risk of stroke or death, and those are anesthetic complications that are inherent with all general anesthesia type operations. We will check your heart and lungs prior to surgery to make sure that it is safe for you to have this surgery. Other risks, which are more specific to your nerves, include nerve damage. I could damage your nerve, and if I do, I can cause permanent numbness, tingling, and weakness down the leg. The odds of me damaging your nerve are very low, certainly less than 1%. But if it occurs, we'll do everything we possibly can to mend and fix that problem. The next risk is a cerebral spinal fluid leak, otherwise called a water leakage. Now, in your low back is a sac full of water and nerve roots. Those nerve roots are going lower down in your body. And the sac is full of water, and that sac is very thin. It's thinner than a golf club. I have to expose that sac, and I have to move it out of the way in order to get to your disc herniation. I don't want to touch it, but I have to in order to get to that disc herniation. And as I'm manipulating it, I can cause an injury to it. If I cause even a small, tiny pinprick of a hole, it'll leak water. Now, when I see that, I will do everything I can to sew that up or to stop that leak. I've never had a leak I couldn't fix. National average of causing a leak is around 1 to 3% of the time. In my own practice, I have caused cerebral spinal fluid leaks very rarely, less than 0.5% of the time. I've never had a leak that I couldn't fix. I am micro-neuro trained, and I'm specifically trained to take care of these kind of problems and the microsurgical techniques that are necessary to do it. Another potential risk of the surgery is not really a risk of the operation, but it's reality, and that is I can't fix the disc. I remove the disc herniation, but the disc will never be the same again. There will always be a hole in the outside part of the disc. Because that hole will be there for the rest of your life, there's about a 5% chance in your lifetime of another disc herniation happening through that same area. Same side, same level, about 5% of the time. I don't think that there's really anything that you can do to avoid another disc herniation there. We'll talk about activity restrictions and losing weight and other issues which are good general health issues. But really, you'll use your back pain as your guideline for activities, not so much your fear of causing another disc herniation. So what we have discussed are some pretty scary things. I want you to understand, however, that by and large, the grand majority of patients go through low back surgery for disc herniations without any complications. They generally go home the next morning or even that night, and generally speaking, their leg pain 90% of the time is gone. More than 90% of the time, they get some strength or sensation back, and it certainly prevents further loss.